I'm Dr. M Sai Bindu, MD Dermatology. So I will be presenting on the many phases of gliptin, a panorama of skin manifestations, a case series. So this is my topic. The many phases of gliptins, a panorama of skin manifestation, a case series. So dipeptidyl peptidase 4 inhibitors, commonly known as gliptins, are integral in type 2 diabetes treatment. So the mechanism of action is they increase the endogenous secretion of incretins by blocking the enzyme that degrades glucagon like peptide 1. So the therapeutic role is their ability to regulate blood sugar without causing significant hypoglycemia has made gliptins a preferred choice in the management of type 2 diabetes. While bullous pemphigoid is frequently reported with gliptins, our clinical practice reveals a wide array of dermatoses associated with gliptin use, each presenting unique diagnostic challenges. Employing the Naranjo adverse drug reaction probability scale as an essential tool for objective causality assessment, ensuring a rigorous and methodological approach in linking dermatological reactions to gliptin therapy. So this is the Naranjo scale. So based on these questions, adverse drug reaction can be scored as 0 for doubtful, 1 to 4 for possible adverse drug reaction, 5 to 8 for probable adverse drug reaction, and greater than 9 for definite adverse drug reaction. So our first patient is an 84-year-old male who was on vildagliptin for 4 months. He developed red, itchy rashes with blisters on the abdomen, arms, and back. Here you can see erythematous scaly plaques which are well demarcated in the anterior and posterior aspect of the trunk and involving the upper limbs and the lower limbs. We can see a blister here. It's a thick blister. So day 21 of OPD visit, after giving him oral steroids and tetracycline and niacinamide, the lesions were resolved. But inadvertently, there was re-exposure to vildagliptin, and the patient developed more aggressive lesions over the trunk, and we can see this thick bullae over the palm and anterior aspect of the hands and the trunk. We can see it is more aggressive compared to the before exposure. Or the posterior aspect of the trunk, and here we can see succinate lesions, bullous lesions, and one hemorrhagic bullae, and erosions were present, which was aggressive, and the Naranjo score was 8, which was positive. This is one of the side effect of gliptin. And the second patient is a 62-year-old male who was on vildagliptin for 2 months. He developed localized blisters, initially at the hands, with severe itching and progress to involve the trunk. So here you can see hemorrhagic bullae present over the anterior and posterior aspect of the trunk. And the Naranjo score was 4, which is probable. And the third patient is a 73-year-old male who was on linagliptin for 2 months. He developed few blisters over the trunk. And again, the Naranjo score was 4, which is probable. Then the next set of patients were 69-year-old male who was on teneligliptin for 1 month. He developed pustules on erythematous base with areas of exfoliation. Can we see few pustules here? This is like in the background of erythema, we can see exfoliation. And it was a biopsy-proven case of acute generalized exanthematous pustulosis. And after day 40, the lesions resolved, and the Naranjo score was 4. And the second patient who was on vildagliptin for 3 months, he developed itchy erythematous rashes over the trunk and the limbs. This was just eczematous picture. There was an eczematous reaction, and the next which resolved, and Naranjo score was 4. And this is also an eczematous reaction with the Naranjo score of 4. Now the next patient is a 63-year-old female who was on sitagliptin for 1 month, and she developed generalized rashes over the body except the face. This was more like a fever rash. Yeah. And I also got a set of patients who had vasculitis like picture. So here, this 41-year-old female who was on vildagliptin for 2 months, a 52-year-old male on vildagliptin for 1 month, and a 43-year-old female on sitagliptin for 2 months. All of them developed purpuric lesions, and there was no other drug other than this which was newly initiated. So we can see purpuric lesions over the anterior and posterior aspect of the legs. Some crossed the abdomen. And similarly, we had a 50-year-old female on vildagliptin for 4 months and a 60-year-old male on vildagliptin for 6 months. There was a little peculiar lesions. It was a vasculitis, biopsy-proven vasculitis, but we can see these bullous hemorrhagic lesions, which were quite aggressive, small as a vasculitis, present in this patient. And this is a vasculitis patient. So our findings suggest a potential correlation between gliptin-induced and the development of diverse cutaneous dermatosis. Most conditions demonstrated a good prognosis upon discontinuation of the drug, except in 2 cases of bullous pemphigoid and 1 case of vasculitis. DPP4, also known as CD26, is a multifunctional transmembrane glycoprotein present in various tissues, including skin. So DPP4 is expressed on immune cells, including T cells, influencing their activation and proliferation. It influences T cell biology, the induction of skin-specific lymphocytes, and the balance between regulatory and effector T cells. So these interact with several molecules affecting immune response, cell adhesion, and chemokine activity, thus altering skin cell function. Gliptins can induce dose-dependent blistering necrotic skin lesions as seen in preclinical studies. They may modify the immune response or change the antigenic properties of the basal membrane, leading to blister formation. This is one of the questionable pathogenesis behind these side effects. And it is associated with increased risk of bullous pemphigoid along with other dermatoses like lichenoid dermatosis, psoriasiform dermatosis, and spongiotic dermatitis. BP associated with gliptins presents as erythematous plaques and pruritic blisters, often without mucosal involvement. Naranjo scoring helps evaluate the likelihood of causal relationship between gliptin use and dermatological reactions. Variability in the temporal relationship highlights the importance of vigilant monitoring in patients taking gliptins. This is one thing where the temporal relationship is actually very variable, right? Ranging from 1 month to 4 months, which is usually not the case in other drugs. So these gliptin-induced dermatosis involve complex pathophysiological mechanisms related to immune regulation and skin immune responses. Timely recognition and management are crucial in patients on gliptin therapy. Further research is needed to better understand these mechanisms and develop preventive and therapeutic strategies. This case series contributes valuable insights into the varied dermatological manifestations potentially induced by gliptins, thereby informing improved patient management. So these are my references. And as Sergey Grando sir, who had come, had told, whenever he sees a diabetes patient, he says no gliptins. So we have to be pretty aware, though gliptins are amazing drugs which regulate blood sugar level without any complication in the sugar levels. That is why people use more gliptins. But this is a problem in dermatology aspect. Thank you.